1. Living with chronic kidney disease. Coping strategies and treatment options. Hello and welcome to this video about living with chronic kidney disease. Chronic kidney disease, or CKD, is a long-term condition where the kidneys are no longer able to function effectively. This condition is progressive and can lead to kidney failure if left untreated. In this video, we will be discussing coping strategies and treatment options for those living with CKD. Segment 1. Coping strategies. Living with CKD can be challenging and stressful, and it's important to find ways to manage stress and maintain a positive outlook. Some coping strategies that can be helpful include: 1. Talking to a mental health professional or joining a support group. 2. Practicing mindfulness, meditation, or yoga. 3. Staying physically active and eating a balanced diet. 4. Keeping in touch with loved ones and maintaining a strong support system. 5. Control and regularly monitor your blood pressure. 6. Take medications as provided by your doctor. 7. Meet your blood glucose goal if you have diabetes. 8. Research your condition and be aware of any concerning symptoms that should be brought up with your doctor. It's important to remember that everyone's experience with CKD is unique, and what works for one person may not work for another. If this is the case for you and you find that the procedures your doctor has put in place to manage your CKD are not working, it is important that you notify your medical professional immediately. Your mental and physical health are important in managing this condition until all of your symptoms can be resolved. It may take some time to find the coping strategies that work best for you. Segment 2. Treatment options. There are several treatment options available for those living with CKD, including: 1. Medications. To help manage symptoms and slow down the progression of the disease, such as: 2. High blood pressure medications. 3. Medications to relieve swelling. 4. Medications to treat anemia. 5. Medications to lower cholesterol levels. 6. Medications to protect the health of your bones. Other common treatments for CKD often include: 1. Being placed on a low-protein diet to minimize waste products in your blood. 1. By lowering the amount of protein you consume, you reduce the amount of work your kidneys have to do. 1. You will most likely also be placed on dialysis, a procedure to remove waste and excess fluid from the blood when the kidneys can no longer do so on their own. 2. Similar to being placed on a low-protein diet, this procedure decreases the workload on your kidneys and provides you time to secure the final treatment, which is a kidney transplant. 3. The kidney transplant is a surgical procedure where a healthy kidney is transplanted into the body to replace a damaged one. 4. After your kidney transplant, you may still be required to be on dialysis until your transplanted kidney is functioning properly. 5. And typically be placed on immunosuppressant medications to assist your new kidney's adjustment to your body. 7. After your kidney transplant, you will also need to attend frequent appointments at the transplant center. 8. So they can monitor how your new kidneys functions and your adjustment to the new immunosuppressant medications. It's important to work closely with your healthcare team to determine the best treatment plan for your individual needs. Do not be afraid to vocalize any concerns you may have with your doctor. Your healthcare team can also provide resources and support to help you manage the physical and emotional challenges of living with CKD. Segment 3. Lifestyle changes. In addition to medical treatment, making certain lifestyle changes can also help manage symptoms and slow down the progression of CKD. Some of these changes include: 1. Quit smoking. 2. Managing blood pressure and blood sugar levels. 3. Maintaining a healthy weight. 4. Make dietary changes such as: 5. Reducing salt, sodium, as they can build up in your body when your kidneys are not functioning properly, which may lead to fluid retention. 6. You may be required to also monitor your intake of products containing phosphorus and potassium. 7. Products containing phosphorus can build up in your body when your kidneys are not functioning properly and reduce the amount of calcium in your bones, making them weak and brittle. 8. You may be required to limit potassium, as when it builds up in your body, it increases the risk of an irregular heart rate, called an arrhythmia, or heart attack. 9. Your consumption of animal protein may also be required to be limited in your diet alongside your alcohol consumption. It's important to keep in mind that these lifestyle changes can also help improve overall health and well-being, even for those without CKD. If you are having a hard time limiting or withdrawing some of these substances from your diet, your doctor may recommend attending support groups. At times it is best to have people around you who understand the issues you may be facing, and who can provide useful tips or a much-needed ear to voice your concerns to. Living with chronic kidney disease can be challenging, but there are many resources and treatment options available to help manage symptoms and improve quality of life. It's important to work closely with your healthcare team and find coping strategies that work best for you. Remember, you are not alone, and there is support available to help you through this journey.